The LHIN believes that timely access to care should be a right for all citizens. Health providers are acutely aware of the difficulties experienced by some patients and families, particularly those in rural areas.
One of the big issues with regards to timeliness in rural communities is transportation and the access to the specialists in that type of situation. We've talked about having specialists that might come once a month or whatever the situation would be. And we really think that that'll really help improve the care here locally that we're going to get.
Health officials have developed a wait time strategy to ensure that surgical patients get the right care at the right time in the right place. But for some patients, accessing medical services can be a challenge.
I applied at the medical center and I was number 1600, and then my daughter was 2000 and something.
I've had a couple knee surgeries, and I find the waiting periods for the times you get like the MRIs or the testing that you get sent to London and then get back, it's a long wait.
Most often it's getting access to the right person and getting the right diagnosis, which can take several iterations before that happens.
We're faced with the same daily struggles as every other person, and at that I expect that we should be looked at no differently than those living in town and larger center, and not have to wait for a month to see your physician, not have to wait for a month to go and see a specialist, that referrals would take place in a quick and orderly time frame.
Healthcare providers say it is unacceptable for patients to suffer.
We are actually the shortest of family physician per capita in the entire province. So that is actually a tremendous barrier to accessibility.
People come to hospitals, to the healthcare system, largely because they are experiencing some sort of pain. And to prolong that pain does not seem to be the right thing to do.
If we can provide the proper level of care, then one would hope that their health needs don't escalate to the level that they do require hospitalization as frequently.
Let's just take a woman who's diagnosed with suspected breast cancer. She's found a lump, so she goes in and she sees her doctor, and then you got to wait to get in and have a biopsy done. And in the meantime, as soon as you find that lump, there's instant anxiety. It's like living on death row. So I think communication has got to be improved, and timely education and information, so we're not having people sitting around in high anxiety.
Making healthcare accessible in a timely fashion is a concern and priority of the LHIN.
I think what the public want is they want to know when I need something in healthcare, I'm not going to have to wait. And if I am going to have to wait, then I have the information that I need to make choices.
I think that the population should expect to find that they have less of an effort in accessing the appropriate care that they're looking for. I'd be wary of expecting sudden, dramatic changes in how healthcare is delivered, because I think what we need is accelerated evolution of our healthcare system rather than a revolution.
By managing the wait times, by measuring the results, it increases the capacity that we have to flow people through. It also educates everybody that we're watching it, and how important is that? Well, it's a very important time for us here in Ontario, and the wait time strategy is top of mind for most of my staff.